The former School of Nursing, located at the Singapore General Hospital campus, will be demolished in July to make way for a new community hospital. More than 600 nurses and their former tutors gathered for its closing ceremony. Vimita Mohandas reports.
It was a walk down memory lane for these nurses as they toured an exhibition of medical equipment used in the 1950s for wound dressing, infant feeding and urine testing. In tandem with the government's move to formalise nursing education under the Education Ministry, this school stopped functioning when Nanyang Polytechnic rolled out its diploma program for nurses in 1992. And then later in 2006, Nanyang Polytechnic started its nursing diploma program as well. And together both schools graduate about 1,000 diploma-trained nurses each year. For some of these nurses, discipline was a core value they learned in school.
They were really strict, very disciplined, right down to our uniform, our shoes, our socks. It's a very sad feeling, and yet it's a feeling of being a progression for the healthcare especially. Okay, so we have to make way for a community hospital here.
Nursing was very strict. The uniform that you have to use is also very strict. Like, you have to well starch your uniform, your shoes have to be very white, your hair have to really be combed back.
Training for nurses has grown by leap and bounds, with close to 40% of registered nurses now holding a degree, master or PhD qualification. To draw more into the industry, a national nursing task force was set up to redesign and enhance nursing. But the challenge of recruiting locals remains, and the task force will look into changing the perception of nurses.
Although the public perception has changed over time, it needs to change even further to show them what other roles nurses can perform. We are usually seen in the traditional care and touch, but they don't see the technical aspects and the thinking aspects that go on into nursing.
The task force will also enhance post-registration nursing education to enable nurses to manage diverse patient care needs.